Welcome to the Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. My name is Dr. Adriana Popescu. I'm a licensed clinical psychologist and leader in the field of mental health, energy psychology, addiction, trauma, and empowerment. In this podcast, we will be exploring mental health from a variety of perspectives, from the spiritual to the shamanic and beyond. What if mental illness isn't everything we think it is? What if everything we see as a pathology is actually a possibility? What else is possible with mental health? Hi everyone, Dr. Adriana Popescu here with you today for another episode of Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. I am so excited to have this conversation today. It is controversial and it is fascinating, and for both of us, I think our hearts are just so open to this, like looking at this piece of mental health as a possibility rather than a pathology. So I have with me today Brittany Quagan, and she is a licensed clinical therapist, the co-director of the Yale COPE Project. She's an associate clinical coordinator of the Prime Clinic and a psychic and medium. As a person with lived experience with hearing and feeling things that others typically don't, and experiencing her own struggles with mental illness, Brittany works to help others on their journey to healing and empowerment. Welcome, Brittany.
Thank you. I can't even tell you how excited I am to be on a podcast where someone says it's controversial. It's very exciting.
Yeah, well, it is, because look, I mean, I was trained, in the sort of classic traditional way, as you were too in school, where we learned that things like psychosis, which we probably should define for the audience, the classic definition of psychosis is like experiencing things that aren't real, right?
Yep.
And that's been the paradigm. It's been considered a problem. It's been considered like there's something wrong with you. And the best typically that the traditional mental health treatment field has been able to offer is medications. Take these meds and let's hope that those things go away. And you and I both know typically it doesn't go away. And that, in fact, that experience of being traumatized and invalidated by the healthcare system can sometimes do more damage than it does any kind of good. And you are lived experience of that. So I would love for our audience to hear a little bit more about you, your story, and how it is that you came to do this work.
Sure. Absolutely. So, I think like many people who we talk to, I think including yourself, who are in the mental health field, we have had our own experiences with mental health. And for me, that is also true. I struggled with anxiety, depression, suicidality, some substance abuse, kind of the whole gamut in there. Since I was really young. The depression, I want to say, kicked in. I had to have been 12 years old or something around that age. I figured that out reading my diaries from back then. I was like, this wasn't right. But then I started hearing voices when I was about 15 or 16 years old. And whenever I tell my story, I like to caveat that when I say I hear voices and I still hear voices, but my voices have never, ever, ever been a problem for me, which is something that a lot of people, especially in mental health, are kind of surprised. Well, what do you mean you hear voices and everything is fine? My voices are awesome. My voices actually saved my life when I was a teenager. The first time I heard them, they were telling me not to kill myself. So I would say that it is a good thing that I have had voices. And, after hearing voices, and it really never fazed me. I kind of assumed everybody had that going on. My biggest struggles were with more, I guess you would call them like tactile hallucinations, or the things that I would feel that weren't really there, or that would just freak me out. And I was really paranoid about my health and about my safety in general for quite a while, from being a teenager into my early 20s. And I was fortunate enough to have a run-in with this woman who is still a dear friend of mine, who is a psychic medium as well. And she pretty much took me under her wing and showed me this world of spirituality, and sort of asked me, like, well, how do you know that it's not energy that you're connecting to, or something different, something spiritual? And no one had ever asked me that. No one had ever brought that world to my attention before. And I was coming from a world where it was therapy, it was medication, it was, this is what's wrong, this is what's wrong, this is what's wrong. And I entered into this world of, this is what's awesome, and this is what's right, and this is what's possible. And how we are just really resilient human beings when given the chance to actually explore our experiences without labeling them. And I was given that opportunity to do that, and it totally changed my life. I was able to get off meds. I was able to stop going to therapy for the things that were really bothersome for me. The things that were bothersome weren't anymore. I had new ways of handling them, and ways to stay grounded and meditate, and just approach things without judging the shit out of them, and thinking that everything was just bad and scary and negative and going to be horrible. And it really just made me that much more passionate to want to help people who might be experiencing the same things as me. And that passion is pretty much what got me here. I started working in the spiritual worlds, doing readings. I had my own business where we would teach like Reiki and meditation, and we were doing readings and teaching people how to develop their intuitive skills and things like that. And I had a lot of people who would hear voices and who would see things. And for me, it was just like, oh, yeah, that's your spirit guides, or like, why are you attracting that? Like, let's figure out how to manifest something better. And just a lot of looking at it differently. And it helped so many people. And then I realized, well, I might get sued because I'm kind of doing therapy. So I should probably go to school and become a therapist. So I did that. And that brought me to Yale, and doing the COPE project and all this really sweet stuff that we've got going on, that really explores approaching treatment from that non-judgmental place, and not necessarily labeling it, but also this idea that people can have these experiences and have control over their life still.
Yeah. Well, and it's so fascinating, right? Because if you look throughout history and you look at other cultures, and it's like one of my favorite articles, is that the one about the shaman and what a shaman sees in a mental hospital. It's like,
Oh yeah.
right. And Western medicine, psychiatry is so young. It's what, 100, 200 years old, but you have thousands of years of these cultural traditions where people have always talked to the spirits and gone into trance states, or eaten the sacred, medicine to have access to other worlds and dimensions. And we have the Day of the Dead, and we celebrate the passing of people from one world to the other. Like, what has happened with the Western paradigm that we disregard what like thousands of years of other cultures have honored as a normal thing, as a celebrated thing?
Right. It's so it's fear is what I think. Like, there's so much fear around that. And it's so interesting too, because like, if you talk to people who wouldn't consider themselves spiritual but more religious, they'll be like, oh yeah, I talk to Jesus every day, or I talk to my loved ones every day. But the second you call it something different, it's like, oh no, that's, you have mental health issue. It's like, how is that
Right.
any different than what you're explaining? But yeah, that is something that just baffles me. And a perfect example, we went to Lilydale in New York. I don't know if you're familiar with Lilydale at all.
Mm-mm.
It's dope. It's this spiritual, it's one of the first spiritualist communities in America. And it's they have their own little town called Lilydale, and third, fourth, fifth generation mediums lived there or still live there. And our lab, so Dr. Powers, Al Powers, who's the other co-director of the Yale COPE Project with me, he and I and a couple of our lab mates, we went to Lilydale for a week, and we had to sit and interview all of these mediums, and they hear voices and see things and feel things constantly throughout the day. And most of them aren't in any sort of mental health care. They don't, need medication or anything like that. And it's because they grew up with that. If you grow up in this world that says, oh yeah, you want to talk to your dead Uncle Joe? Sure, that's probably who's visiting right now. Oh, that's normal. Then there's nothing to be scared of when that happens.
Right.
And it's that fear that I really feel like causes so many people to spiral. And I get that, including me. I was telling you earlier today, when I started at Yale, I was so grounded. I was, I'd have my experiences. Oh, here's that energy. That's for this person. That's for that person. Oh, cool. Just moving through my day, nothing bothering me. And I started there. And I will say, the people that I work with are amazing. They do not pathologize me. They do not think that I am weird. They do not think that there's anything wrong with me. They're always like, oh, they're just encouraging and empowering. Never say anything that is not supportive whatsoever. So it's not them that made me feel this way. But working there, and you're working with patients, and you're doing these assessments, and they're having these experiences, and then we're diagnosing them. It really made me question my sanity. It made me wonder, oh my God, is this the road that I'm going down? Is this going to happen to me because I'm having these experiences and blah, blah, blah. And I really formed this really negative view about it for a while that caused me a lot of anxiety and sent me kind of spiraling backwards, where when I was just in this world of spirituality and things were not considered problematic and more just this really cool experience that humans can have, I was chilling. So it really is just this fear and the negative stigma attached to it that I feel like can make people feel way worse about the experiences that they're actually having versus it being just a normal thing.
Well, and I think that really brings us to how important it is that for the people in the lives of these folks who are having these experiences, whether it's family, friends, loved ones, or even therapists, like how important it is for us to not put any fear or whatever we have and project it onto the person, right?
Mm-hmm.
Because I think that is a lot of what I hear, at least from working with clients, when we're able to broach that conversation, and they get that I'm not here to judge them, and in fact I have my own experiences with this stuff that I can share, then suddenly they feel like, oh my God, I'm not alone. Mm-hmm. I'm not crazy. I mean, that's usually the thing people are afraid of, right? I'm gonna go crazy. I'm gonna lose my mind. I'm gonna end up like institutionalized and locked away forever. And to know that, like, maybe that's not something to be feared, and this isn't as weird as you think it is, and this is why I'm even doing this like podcast, is to educate our fellow professionals, because how we treat our clients can really do damage. It can traumatize people, right?
Absolutely. I have one client, for example, who hears voices constantly, and when they first came to the clinic, they were just terrified. I have schizophrenia. Oh my God, my whole life is over. I was going to go and do all these great things. Now I don't get to do those great things. And I finally looked at them and I was just like, who cares that you hear voices? And they were just like, what? And everything changed because they were waiting to get slapped with this diagnosis or told that something was wrong. And honestly, after talking to the kid and hearing about his experiences, he's lonely. Like, no friends. So he's got a bunch of voices in his head that he's talking to all the time. They don't cause any harm. They encourage him to get up and do laundry and go to school and stuff like that. It's like, who cares? if somebody is hearing voices or seeing weird things, if it's not causing a problem, if it's not distressing to them, if it's not going to cause them harm or someone else harm or screw up their life in a way that can't be fixed, just who freaking cares? Right. And I think that that's a really almost not hard concept, but people are really challenged by that idea. And even when we present on these things, you could see some like old school people being like, no. And I've met a psychiatrist. Like one time we had a lab meeting and this older school psychiatrist came, and we were talking about voice hearers and people being able to develop control of this. And when I talk about control, what I mean is like mediums, for example, really have this ability to tell spirits to like kiss off for a while until it's time for them to talk to the person that they're having a session with. And then the spirit shuts up. That's control. Like if you can keep them away, like you're controlling your experience. And we were talking about this, and we were talking about, you know, how there's a lot of voice hearers out there who can function. He had no idea who I was, by the way. And so he's like, no, that's just not possible. And I'm just like, I'm a voice hearer, and I'm telling you it is possible. And it's almost like I don't condone violence, but it's like, you want to get up and fight these people. It's like, how are you going to sit here and tell me that it's not possible to function? And like, I'm not on meds. I'm not like, I have a great job. I got a family. Like, yeah, it's called functioning, if I understand the term correctly, you know? Yeah. And people, yeah, they're really challenged. And is it the training? Is it fear? What is this like issue with wanting to really explore other possibilities with how we approach these things?
I think it's all of those and more, and it doesn't help, you know, like, so, you know, I practice a modality called talk to the entities, which is a subspecialty of a bigger technique or approach, you want to call it, I guess, called access consciousness. And when I have classes or do sessions with people, the fear piece always comes up. And for a lot of folks, it's what you saw in Hollywood, you know, like I'm of the generation of The Exorcist,
oh yeah,
Poltergeist, and all of those like horror movies. And
yes.
And even in religion, I think if you grew up in some religious traditions where they do the exorcisms and all of that, or like the speaking in tongues, you know, like when people are doing that kind of stuff, I think it's scary. I think little kids look at that and they're like, oh my God, that's really bad. Yeah. So we have to do a lot of clearings around that, around the concept that gets attached to, you know, spirits, ghosts, whatever. They're bad, they're out to get you, they're more powerful than you, they can hurt you. And I think you really highlighted in your comment about the mediums, it's really about being willing to be the dominant entity. Like, hey, I'm the boss, this is my body, and I'll talk to you, but on my terms, you know, like when I say it's okay, like you don't get to wake me up in the middle of the night, like, you know, trying to get my attention. Like, I'll talk to you, but let's negotiate this, or it's going to be on my terms, right? That's what I've heard from a lot of channelers as well. Like, they have to put kind of rules or parameters around like how they're going to do this work, because otherwise, you know, people can get bombarded. And I wanted to explore that with you. So what happens for folks? What do you see happens for folks when it's not in their control and they're not able to manage it, or the fear that is so great? Like, then what do you see with those folks?
Yeah. So with those folks, I feel like the first thing that's important is the education piece on, you know, what's going on, and that control is a possibility, because some people are scared that this is just going to be it forever. And to learn that, you know, you can take the power back is huge. And then to meet other people who have done that is extra huge. Like, any human on the planet can attest to the fact that when you meet another human who has gone through something that you have, it is that in and of itself is relieving, but never mind the fact that they've gone through it, but they've overcome it or they've mastered it, is like, holy shit, this is possible.
Mm-hmm.
And so to normalize it, huge. Community connection, huge. Then you got to get them grounded, help them to get grounded in the experience, and then be able to explore it, not from a place of fear. Because I think, as with anything negative, whether it's feeling sad, whether it's feeling anxious, whether it's feeling angry, heartbroken, the first thing we want to do as humans, because it doesn't feel good or doesn't seem right, is we want to push it away. We want it gone. I got to run away from this. I can't even go there or touch it. Mm-hmm. And to be able to sit with someone and say, like, okay, nothing's going to hurt you. What if we just ask some questions? Like, when do these voices start talking to you? What do they want to say? Like, what do you think they want to talk to you about that for? Like, especially if we're talking about like spiritual stuff and they feel like it's spirits, what does the spirit want? Maybe they just have a message. But even if it's not a spiritual thing, what could these voices be telling you? What is it that, you could learn from the experience? Exploration is key. I mean, that's the only way you're gonna learn anything about it and be able to come out of it, is to really dig into them trenches and see what's in the mud.
Well, and I think a piece of it that comes up so often for folks, especially some of the more, let's say, where people can't function as well with this, is when there's been trauma. Can you say a little bit more about folks you've worked with who've had trauma and how that converges with the psychotic, type experience?
Yeah. If I'm being totally honest, I explore it almost the same way. I mean, maybe a little more gently, because I tread lightly around the trauma. I don't want to force people to relive any trauma over and over again. But, just simply exploring how the traumatic experience could be playing a role in the content of the voices, or when the voices come up. Or, I mean, I think the content is so telling, whether it's, shameful thoughts that you have after a traumatic experience, or just as an example, like I might have somebody who has shameful thoughts about themselves being dirty or something. And then, then they have like dirty coming up in their head all the time. And then that just forms into bigger and longer narratives. And it's kind of just being able to challenge some of those things too. My whole thing is like, I kind of see voices the same way I do people. Yeah. Like, my mom says shit to me and I'm like, shut up. You know what I mean? Like, she'll say some stuff and I'm like, I literally have no idea what you're talking about, or, what you're saying to me, I don't agree with. And I think there's just so many different types of voices that I guess, there's different ways to approach it with different people. But, for something like just these intrusive thoughts and intrusive voices saying things like, you're no good, you're dirty, you're this, you're that, it's being able to challenge it too, just the same way you would a person. Like, if somebody's coming up to you all the time and they're like, you're dirty, you're this, you're that, I'd be like, right. What are you talking about, man? No, I'm not. And I think it's giving people the power stick back to be able to say, yes, you can challenge that. And you don't have to take that on as truth, just like you don't have to take a negative thought when you're depressed as truth, or an anxious thought as truth. It's all kind of the same thing to me.
Yeah. Well, they've given their power away, right? In a sense, like, and especially traumatized people, if they've had like abuse or that kind of thing, they they gave their power away, to that person in the moment when they were, and then they learn. And especially if it was like a chronic kind of thing, they just learned, like, I have no power here. I have no choice. I have to take it. And I see that as we empower people, like you said, to take their power back, then they can start to stand up to the bullies, right? And sometimes these energies, these spirits, these voices, whatever, they're like bullies, right? And they need to be told off and flipped
Right.
off, and, right, and confronted, and like, hey, I'm not that person. I'm not what you think I am. I mean, always, I think it comes back to how we see ourselves,
Mhm.
and the beliefs we have about ourselves, and where are those coming from, and can we change those regardless of whatever somebody's diagnosis is or what they're
Right.
dealing with.
Right. It's like you could walk around and say, I'm sick, I have these things. Or you can walk around and you could be like, yeah, I experienced that and I'm still kick ass. I'm still, capable. I still have potential. I still can grow. I still can do all these things. It's like when you start slapping labels on people, especially labels that come with a stigma, it's like, of course you're going to think that your life is over, because you see these pieces on people with schizophrenia, and it's like they always show people as just like batshit crazy, you know what I mean? And like have absolutely no control. And there's a lot of people who thrive who have psychosis diagnosis. That was a combo of words, a psychotic diagnosis.
Yes.
Um, and yeah, I feel like you're right. It really comes back to letting people feel empowered in their experience, regardless of what the experience is. And I think it's just sad in general. Our world is, at least here in the US, I don't know about other places, but I mean, humans really point out negative things and just harp on things that are wrong with people, and they bully people, and it doesn't give you a lot of room to feel empowered. And if we as clinicians are seeing these people, I think it's our responsibility to do everything we can to empower them, especially if they're not getting it in their regular life.
Yeah. And you highlighted such an important piece of that, which is the community aspect, right? Can you say more about that, and about the recovery movement and the different organizations and support groups that have cropped up that I didn't know about until I started doing some research? I don't think the average clinician or person, for that matter, who's diagnosed with these things, or their family members, has any idea that these groups and movements are out there.
Oh yeah. There's one huge recovery movement that we work with the COPE Project, called the Hearing Voices Network, or the Hearing Voices Movement. They're all over the world. And it's peer led. Like, these are all people who have lived experience, and they are just building community all over the place, which is so cool. And they train people to be facilitators in their groups. They have groups everywhere, and it's just, you have this safe, non-judgmental space to go to talk about your experiences, to learn how to move through these experiences. I always like to call it like learning to work with your experiences rather than against. And so like my experience was always like I said before, like stop it, stop it, stop it. So like you're not working with the experience there by just putting up these stop signs all the time. You want to learn how to kind of wiggle around with it wherever you can. And they do a lot of that work. Interestingly enough, a lot of the techniques that they use are the same techniques that psychic mediums used. So, and we talk about that in some papers that we wrote, but it's to me, it just speaks volumes about the techniques that we could be using with people, and normalization being one of the biggest. And you get that through community. You get that through meeting other people who have these experiences. And not for anything, these experiences are a lot more freaking common than people realize.
Oh yeah.
Millions and millions of people hear voices, and they just don't talk about it because it's not problematic for them, or they're like terrified to talk about it. I know.
Yeah, I think
I
they're
was
gonna get judged.
I was when my doctor used to say to me, like, well, so are you hearing anything? I'm like, no, ma'am. No, I'm not. Because I knew I would be like, okay, so she's paranoid and she is hearing stuff. We're gonna write this script up for her.
Well, I think the other piece too that kind of dovetails with this is the whole like empath, highly sensitive person conversation. Like, so I work with addiction, and I work at a rehab, and I teach the clients about that, because I think a lot of what they're doing with drugs and alcohol is they're trying to numb that sensitivity, that awareness, which, when I can go there, when I can see there's an opening, I will say includes things that other people may not be able to normally see or hear. You're also probably aware of and picking up on. And if you don't have tools to manage it, you think you're going crazy, you're getting overwhelmed, right? And I think there's so much more even with that, where that overlaps here.
Totally. That was 100% my experience. And drugs and alcohol were my bestie because it numbed me out so much to just not feel all of the things that I was feeling. Like my body always felt like it was just like being tased, just all the time. And then you're feeling this, you're feeling that. And then my face would go numb. And then you get the heart palpitations. Then you're like, am I dying? What's going on? And then you get these weird thoughts about things that aren't actually going on in your life. And it was a roller coaster. And I think that I love that being an empath is something that's getting more widely talked about, especially like in mental health, that people are just more commonly being like, oh yeah, my client's an empath. I'm like, oh my God, this term is just growing. It's so great.
Yeah.
It's becoming more normal.
Yeah. And to thank people like, Judith Orloff, who's a psychiatrist, who writes and talks and trains, on this topic, and again, normalizes it and talks about how her empathic gifts are that, a gift. And just like hearing voices and sensing things, it can be a gift if you learn how to manage it. And I think what people have not known is that there are tools. There's lots of tools of all different kinds that people can use to do everything from grounding themselves to setting boundaries to self-care. I mean, all these things to actually then using, like I work with my guides, to help me like create my life, like create a business and bring clients in and bring money in and, like do healing and all kinds of cool stuff, and they contribute to me in my body. And like, there's amazing possibilities that are available if people are willing to like seek out. Because I don't think this is stuff most people can navigate on their own very easily. I certainly couldn't, with my stuff. I needed guidance. I needed mentoring, training, even if it's like working with a shaman or like you did with like psychic medium, but we all need some sort of guidance because it's strange exploring other realms, dimensions, realities that this reality that we're all born into doesn't know how to explain, right?
Right. Yeah. I think whether you're talking about weird experiences or life in general, we all need a guru. We all need a person, because there's just a lot of things we don't have experience in or have any expertise in. So to have people who get it and can give you some guidance is huge. One thing that I have heard quite a bit that I think is relevant to bring up is I've worked with a lot of people who have voice hearing experiences, and the idea of looking at it as a gift is very angering for them because their experience has only ever been negative. And they're like, how can you look at me and tell me that this is a gift? And I'm like, dude, I get that. So like, now I'm just like, okay, so what if it's not so much a gift, but your brain being maybe not really nice about it, but giving you the ability to explore deeper into yourself and things that you need to heal. So it's like the healing is going to be the gift if we explore this versus like the act of hearing the voice itself might not be the gift. Because I used to say that all the time. I'd be like, but it's a gift. And they would be like, are you kidding me, bitch? Like, you're telling me that this monster in my head is a gift. And I would be like, yeah, that's true.
But that's a really good point, right? Because we have to meet people where they're at. And maybe someday they can get to the place where they can see it that way, and maybe they won't. But we don't want to impose our perspective, either positive or negative, right? Apologizing or overly positivity, pushing an overly positive look. Like how important it is to meet the client where they're at. And gently, walk with them down this road of exploration and let's see where it goes.
Right. Yeah. And I think that's important to do. Even like, why even try to get them to say like, oh, I have schizophrenia, or oh, I have this, or oh, I have hallucinations. Just like work within their framework, I think is huge. Like if they're calling it spirit guides, if they're calling it aliens, if they're calling it, my alters, which is a new one that I've been hearing quite a bit lately, fairies, whatever, work within the framework. Like, why do you have to call it your thing just because like your clinical training said that it's an auditory hallucination? It's
Right.
just, it can harm. Why not just go with where they're at? Like,
Yeah,
okay, so what are your fairies telling you? Like,
exactly.
I have one client, we're like, all right, where's your squad? Because they just have this squad of people in their head.
Yeah.
Um, I think that that's extremely important.
So tell us more about this COPE project. What exactly are you all studying? What have you discovered so far?
Yeah. So I talked a bit about control earlier, and this idea that people who have voice hearing experiences can have control over them. And that means, telling them to come back at another time, telling them to go away, telling them to quiet down so that way they can function, whatever, just being able to have some influence in some way over the actual experience itself. Um, and that is something that we are exploring extensively in the COPE project, which COPE stands for Control Over Perceptual Experiences. And within the project, it started out as helping us to validate the first ever um, scale to measure a person's ability to control their perceptual experiences. So there's no scale out there that exists except for like one or two questions on a clinician rated assessment called the CIRATs. And it's like, does the person in front of you have control over their experiences? It's like, okay, that's really going to help us. So we developed the first ever scale, actually working with mediums at Lily Dale, working with the Hearing Voices Network, working with people who actually have experiences. And they helped us with the questions. They helped us with the language to make sure that it was really as inclusive as possible. Because even just saying something like the voices versus my voices can actually be really impactful for people. And so participants in the project helped us and continue to help us because it's still ongoing to validate that scale, which is huge because being able to validate that scale in and of itself is helping us to prove the point that people can actually control their experiences. And our hope is that, once that gets published, that it becomes a widely used tool for clinicians to be able to measure someone's ability to control their experience over time. So you might have somebody who's really ungrounded and really overwhelmed by the experiences that they're having at the beginning. And then over time, you can actually track that progress, which is helpful for clinicians and for the clients themselves. So that's a huge part of COPE. We ask a million other questions about their experiences, from trauma to sleep habits to anxiety and depression questions, about the experiences themselves, what they sound like, what they feel like, what they say to you, content. People have the opportunity to share their actual story. And they participate in these tasks that Al developed, that actually help us to see the way someone is perceiving their own world, and how well that correlates with the scale in someone's ability to develop control, because we do follow-ups at 6 months and 12 months, and we can see, if people have changed over time and how that correlates with their answers on the scale, and their other answers. And the hope, we have a lot of hopes for this. One is to be able to, so Al's the computational neuroscience, and as often as I presented with him and talked to him about this stuff, I still have just such an inability to explain the neuroscience part of it. He's so much better at that than me. But ultimately, for us to be able to see, you know, how well somebody's able to develop control, but if there's certain markers that can help us to identify if someone's more likely to have psychosis, or develop it down the road. And then also just for treatment purposes, to be able to use all of the information that we get, the stories that people tell, the things that work, the things that don't, because we ask about, you know, the techniques that they use and things like that, if they do have control, to help us create, you know, better protocols for clinicians and doctors to use in the treatment of people who have voice hearing experiences and other perceptual experiences that aren't just going to be pharmacologically based, or that, you know, meds aren't going to be the front line if not needed. Obviously, there's a huge difference between someone who's like completely not functioning and might need it to learn the techniques,
Right.
Versus somebody who just has these experiences, they're really stressed out about it, but they have the ability to learn them. Why not go that route, and let's use these ones that we're going to work to validate over time.
I think that's really key for us to stress, that we're not saying that meds don't have their place, right? You
Mhm.
know, we're not part of, like, there's some groups of people that are like anti-meds, they're all bad. No.
Right.
Psych meds always have a place in this industry when people, like, for example, at the rehab, when they come in wrecked, when their system is totally out of whack, when their sleep is all wonky, when their neurotransmitters are all, you know, imbalanced because they've been, you know, abusing them for so long.
Mhm.
You know, like, they
Mhm.
have their time and place, but they're not an answer. And I think that, unfortunately, the traditional psychiatric paradigm, the answer for
Mhm.
psychosis, which is a pathology, is meds, antipsychotics.
Mhm.
No, they have a place and a function, but they're not the answer. And
Right.
I'm just so grateful that you guys are doing this work for our field. And so, one of the questions I wanted to ask as we start to wind it down is, what resources would you suggest for the mental health professional or the counselors who would like to learn more, open up more to this other way of seeing things, and maybe, you know, unlearn the classic DSM paradigm that we've all had to study? Where would you suggest they go?
That's a really good question. And one that I've actually never thought about, but on the fly, my first suggestion is that people actually explore these worlds for themselves open-mindedly. Like, you have literally nothing to lose by going to a class on spirituality. You have nothing to lose by reading a book on it. You have nothing to lose by going to a recovery movement meeting and seeing how somewhere like the Hearing Voices approaches care with their clients. We encourage our clinicians to get trained by the Hearing Voices movement and to learn how to be a group facilitator, because you learn how to work with people who have these experiences and to do it in an empowering way, and a non-judgmental way. And again, what do you have to lose other than exploring how to work in other frameworks? I think, you know, um, this is something that we all have to kind of, to me, it's as simple as when we have to go take cultural competency classes. You know what I mean? Like, you're learning about other cultures you know nothing about. There's no harm in that. All you're doing is helping your clients. And I think it fits in the same mold as that. You're learning other frameworks that people might have that are going to be more helpful than harmful. Um, and I think that that's imperative for us to do in general, because, you know, people come to us for help, and we need to be able to help however we can. And sometimes it's not going to be in the way that you would think is the norm.
Right.
Um, Not everybody needs the same thing as we do.
Yeah.
And not everybody needs the same thing as, you know, Joe over here. People might need something over here a little bit. And I think being able to take the time to recognize that we all need to explore that, um, and then doing it is crucial. We're not saying that you have to believe in psychic mediums.
Mm-hmm.
You know, I don't believe that aliens are infiltrating my mind, but some of my clients do. So how can I learn to explore that a little bit, you know?
Yeah. And be more inclusive rather than exclusive. Yeah. There's a professional organization too. I believe you've spoken at. It's ISPS, right?
Yes. Yep. We
And
got connected to them through the Hearing Voices Network.
Yeah, it's International Society for Psychosis Studies, maybe, or something like that. We're going to include it. I'll look it up. We'll include it in the show notes. Make sure that we have that in there too, because yeah, there's some cool videos of talks. There are other professionals out there, mental health professionals that are doing this work, that have developed approaches and techniques. Mm-hmm. So there is actually, I was really surprised to discover how much has already been created. Yeah. So we'll definitely include that. We also, you're still recruiting, right, for the COPE research study?
Yeah. Yep. Absolutely. And it's all online. So you can do it from wherever you live. And you could do it even if you don't have control over your voices. If you have the experience, we want to hear about it. Or if, you know, you are a psychic medium, or if you just have visual experiences, or the idea of aliens is really bothersome to you, and, you know, you're feeling like you experience them in some way. Yeah. Come participate. It's rather lengthy. It can take, you know, 4 hours or sometimes a little more, if you're just sitting there straight through, but we give you a month to do it. And then we pay you for your time. So you're not doing it for nothing. And then also on the other side of it, you're helping us with treatment development. Yeah. So
I actually participated in it myself. And I really support, yes, let's all of us who have these experiences, you know, be willing to contribute to our field moving forward in a more inclusive way. So I'm all for it. And we'll put all those links in the show notes. And if people want to find you, if they want to talk with you or even work with you, how can they do that?
Absolutely. Just send me an email. I'm very accessible. It's brittany.quagan@yale.edu. And if there's a place for us to put that for people to click on, because my last name's probably not the easiest to spell.
It'll all be written out. Yes.
Beautiful. Yeah. Email me anytime. I'm always available. Well, not at midnight, but you know, I'm accessible.
Thank you so much, Brittany, for being a guest today. I've really loved this conversation, and it warms my heart to know that there are other people like myself who know that there's more going on than what we've been taught, and who are willing to challenge that paradigm and be controversial. And I think it is a gift to our clients for us to be able to approach them with non-judgment and curiosity and a willingness to explore this with them, even if it's difficult, even if it's scary and weird. Any final thoughts you want to leave our audience with?
Oh my goodness. I have a lot of thoughts. I mean, I'm first of all super thankful that you had me on here. It's great. I think this is just something that we should all continue to talk about. I mean, my biggest takeaway is, you know, how is it going to negatively harm our clinicians to explore something a little different than what they're used to? I just always want to encourage people to push the norm, because all this shit's made up anyway. So let's push the norm and do what we can to help people, because that's our job. And yeah, just because it's weird doesn't mean it's not normal.
Thank you so much. And thank you all for tuning in today to this episode of Kaleidoscope of Possibilities. If you like this podcast, please do click like, share, comment, so that we can get it out there in the world and really show more people what else is possible with mental health. Thanks for tuning in. See you next time. Thank you for joining me for this episode of Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. This has been Dr. Adriana Popescu. If you enjoyed this episode, please like and subscribe and share with others. To find out more about me, my guests, and more, please visit my website at adrianapopescu.org. See you next time.